Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Today we are discussing NEETPG mock test 11. Totally 50 full-scale NEETPG mock tests, 50 into 200 questions, 10,000 MCQs. Every test has 30 to 40 image-based questions. It also has clinical vignette-based questions. They're all the high-yield topics, which are the favorite topics of the examiner. If you are able to score more than 160 in the 60 questions correctly in the 15 NEETPG mock test series by Dr. Murali Bharadwaj, you are sure to make it to the top 1000 ranks. That is mere vada. आपके लिए. So enjoy wonderful discussion. But before the test, I give you the PDF. Make it a point that you do the revision of you solve all the 200 questions with a timer and alarm, and then you join the discussion. Also, there is an ebook containing all the 200 questions, explanatory answers as mind maps with a quick revision of the very, very high yield facts about the topic in the given MCQ, along with the explanation of the right answer. You solve these 200 explanatory answers, mind maps, PDF as ebook, download it, share it with your friends, no problem. But you all sit and do the discussion so that you are ready for the tomorrow's exam. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Can you please punch? Can you please punch whether voice is clear and loud? Nice to see Dr. J.J. Singh and many more who are all online. Yes, doctor. So let us start the game. Thank you, Ravi, J.J. Singh and many more who are all online. Good. So let us start the discussion, doctor. See, this is how once you download the PDF, you are having the cover page. Then you have the schedule of our mock test series. Then you have the question paper PDF. This I will give to you before only in the WhatsApp study group. So you will get enough time to solve the paper before you come for the discussion. So once you download this PDF, doctor, all the 200 questions, the explanatory answers are in the form of the mind maps. So you will get in every mind map all the high yield topic points about each of the topic to which this question is being asked. So that way you get the full revision. So doctor, let's make the great beginning. A patient with progressive visual disturbances and headache, MRI is being shown to you. This is very typical of sphenoid wing meningioma is what you need to basically remember. A patient presents with a gradual vision loss, MRI scan is being shown to you, and these findings are more consistent with inflammatory disease also, it can be there. So what is this more likely? There is an enhancement around the optic nerve. If you look at here, there's an enhancement. This is the optic nerve, doctor. There is an enhancement around the optic nerve. So, which is highly suggestive of a optic nerve sheath meningioma is what you need to basically remember. Optic nerve sheath meningioma is what you should remember. So please inform your friends in all the WhatsApp groups that our live class has started. so that they all can join. So, doctor, increased intracranial pressure, visual disturbances, hormonal imbalances, MRI scan is being shown to you. So what you are seeing here, dumbbell shaped mass. What you see here, dumbbell shaped mass with inhomogeneous high signal intensity on a T1 weighted MRI in the region of the pituitary gland strongly suggests craniopharyngioma. Typically, it has an impact on the hormonal function, intracranial structures with increased intracranial pressure as a presentation. They're all dumbbell shaped lesion is very, very characteristic of craniopharyngioma. A patient is having headache, transient visual obscuration, transient only. Fundoscopy is being shown. MRI rules out any brain tumor and cerebral hemorrhage. After 3 weeks of acetazolamide treatment, the patient has recovered. So visual acuity has recovered, which is strongly suggestive of papilledema is what you need to remember. Papilledema. A 54-year-old male smoker, alcoholic with diabetes, with swollen eyelids, hyperemic conjunctiva, visual disturbances, he has got tremor. So it is thyrotoxicosis with the Graves ophthalmopathy is what you need to recognize. So any thyrotoxicosis is not called Graves unless the ophthalmopathy is associated with the clinically found hyperthyroidism, then only that hyperthyroidism can be ascribed to the Graves. That's what you need to remember. To diagnose the Graves, the most important thing you need to remember is presence of the ophthalmopathy and eye changes is very, very important. A patient presents with a sudden onset of visual disturbances and confusion. So the MRI has been presented to you. So it shows the infarction of the right occipital lobe and a bold infarction in the left parieto-occipital lobe. There is also some amount of encephalomalacia. You can see encephalomalacia. That is, the brain matter is degenerated. They're all characteristic of a bilateral posterior cerebral artery infarction, which will present with visual disturbances and confusion. So, even in the case of multiple sclerosis, you may get a lesion like this, appearance like this. But the presence of visual disturbances and confusion help to differentiate the condition from multiple sclerosis, which will show more diffuse and multiple plots is what you need to remember. So now, doctor. So I leave the literature for you, how to approach this radiological imaging associated clinical vignette on the posterior cerebral artery infarction, differential diagnosis, how to approach, right? So very nice to see 9 online classmates. Very good, doctor. So JJ Singh is asking, can you repeat this, sir? JJ Singh, can you please mention which question number you want to repeat? Now, a patient with a history of immunosuppression presents with a rapid onset of vision loss and motor weakness, and MRI has been shown to you. So typically, in those who are immunocompromised, when their CD4 count is very low, as in the case of the HIV patients, typically they will get the multifocal leukoencephalopathy, which is caused by the JC virus infection, which typically presents with these typical imaging findings. So the axial flare image typically show high signal intensity in the white matter areas and the ex vacuo dilatation of the occipital horns, indicating advanced white matter loss. That is what you see in case of the progressive multifocal leukoencephalopathy caused by the JC virus is what you need to remember. Very nice to see 10 online classmates. Very good, doctor. Please inform all your classmates in the WhatsApp and Instagram, whatever the groups you are in. So we have 50 full-scale grand tests, doctor. 50 full-scale grand tests. Out of them, already 10 grand tests are over. This is the 11th grand test. Remaining 39 grand tests I am going to launch before June 23, almost every day or every alternate day. So every test, 200 questions, 200 explanations in the form of the mind maps, where you get all the high-yield facts about the topic. At least 35 to 40 image-based questions I will give. Practice them. This 10,000 MCQs practice is all that you need to become a topper. And all these YouTube discussions are absolutely free. Only thing is, go to learnograph.com. I'm once more typing for you. learnograph.com. Below also, I mentioned the link. And then download the PDF. You can share it with your friends. Only one person can buy for $500 and can give to 50 people. No problem. But solve it. Discuss among friends. And then follow this discussion. If you do that every day, finish all the 50 full-scale mock tests, ebook PDFs that I give to you. That's more than enough for you to become the topper in the NEETPG, doctor. कहीं भी कोचिंग लेना, but मुरली भारद्वाज के साथ 50 full scale mock test का revision करे तो it is a guaranteed prescription to become the topper in the NEETPG. So, doctor, a 10-month-old infant has got a history of preterm birth, developmental delays, visual impairments. A CT was done. So this is the classical feature of a ischemic area, edema, laminar dystrophic calcification, typically in the occipital lobes, which is very characteristic of hypoxic ischemic encephalopathy, which is very common in the case of the preterm, etc., etc. So I leave the literature about the HIE. Now, a patient presents with a long-term long-term visual recognition issues following a vascular event. MRI was taken. So he has a difficulty to identify colors, faces, places, objects. So whose function is all that? It is the temporal lobe and occipital lobes, which are very important. Here, bilateral, temporal, and occipital infarction is there, is what you need to remember. So, I leave the literature for you. Prosopagnosia, that is inability to recognize familiar faces. Anjan Marna, because of the damage to the fusiform gyrus in the temporal lobe. Then acquired achromatopsia, that is, earlier the guy is not colorblind, but now he becomes colorblind. That's called acquired achromatopsia. Topographic agnosia, that is difficulty to recognize familiar places and navigating the environment. And visual object agnosia, that is difficulty to recognize the common object, even though the sensory function to see the objects remains intact. They're all the features of temporal and occipital infarction is what you need to remember. Now, doctor, A patient presents with inability to read and a visual field defect. They cannot see to the right with in both the eyes. In both the eyes, right was not seen. MRI is being shown to you. So typically, in the MRI, what do you get? Hospital load. There is a high signal intensity. So the patient has pure alexia. He has a right homonymous hemianopia, specific loss of reading ability without the loss of writing ability, which are indicative of pure alexia because of the infarction in the dominant occipital area, which is a visual word form area necessary for reading, is what you need to basically remember. So I leave the literature for you, doctor. Pure alexia with left occipital infarction is one of the favorite questions of the examiner. Good to see 12 online classmates. Very good, doctor. We are becoming very popular, right? So what is important is it is not about the coaching program, the apps, the costly 1 lakh rupee face-to-face classes. They're all not the need of the hour. The need of the hour is to know what are the 1,000 topics to revise and solve the 50 full-scale grand tests and follow the explanations in 200 mind maps for every mock test in the form of a PDF, ebook that you download from learnograph.com. Now, patient has got a bulging of the eyes, a whooshing sound is there in the ears. There's a double vision, swollen red eyes, digital subtraction, angiography is being done. So what is this, doctor? Carotid cavernous fistula is what you need to remember based upon the clinical presenting features. So I leave the literature for you, doctor. All the points that you need to remember about it. A teenager presents with a persistent knee pain worsening in the night. There are mixed lytic and sclerotic lesions with a new bone formation with a Codman's triangle. What is it, doctor? Osteogenic sarcoma. You should identify the radiology of the bone tumors. One of the favorite image-based MCQ in the NEETPG exam. A child has a visible deformity near the knee, discomfort during physical activity, and there is a bony outgrowth with a continuous cortex and medullary cavity extending into the native bone, and histology show a disorganized growth plate. So all these are suggestive of osteochondroma is what you need to basically remember. So everything about osteochondroma, I leave the literature for you in one mind map, which you need to do the revision, doctor. Right? Now, a patient has got a mild pain in the finger following minor trauma, and X-ray has been shown to you. And also cartilaginous histology. So well-defined radiolucent nodule with the central calcification of the proximal phalanx with the thinning but not penetrating the cortex is typical of enchondroma. There's a benign cartilaginous tumor, and you can see the histology and that radiolucent nodule centrally located. They're all the very characteristic features. A patient has a painful growing mass on her thigh, and the mass gross appearance histology has been shown to you. So hypercellular cartilaginous mass that is permeating through the medullary cavity, growing towards the cortex and forming a soft tissue mass with anaplastic chondrocytes and a highly cartilaginous matrix is suggestive of chondrosarcoma, is what you need to be able to recognize based on the gross appearance. So remember, doctor, Every NEET PG exam, if you look at the 2023 question paper, 56 MCQs came image based. 56 MCQs are image based. Can you imagine? So almost 1/3 of the question paper is going to be image based. So that's the reason you should know what are the common images, how to interpret based on the clinical vignette clues, and then the appearances. And it is very easy. Nice to see Ravinder. Thanks for joining. Late but the latest arrival of the hero from Punjab. So our topper in making, Ravinder, I'm very glad to see you. So please tell all your friends, past 3 days I was traveling, I could not take a class. But my point is every day one mock test you take, download the PDF and do the explanatory answers, have a discussion among friends and be ready for discussion. All right, doctor? Now, so let's go to the next question. A young adult with persistent bone pain and swelling in the thigh, lytic bone lesion, onion skin appearance, biopsy is being shown to you. So, doctor, biopsy is showing what? Small round cells. They are called small round cells, typical of Ewing sarcoma. The patient's age, diaphyseal location, onion skinning, periosteal reaction. They're all the features which point the diagnosis towards Ewing sarcoma is what you need to remember. A young adult patient with the pain and swelling at the knee and the imaging is being shown to you. So what do you see? A huge lytic lesion you are able to see, which is very characteristic of giant cell tumor of the bone is what you need to remember. A young patient with pain and swelling of the lower limb and the eccentric expansile osteolytic lesion. It is not central, it is eccentric expansile osteolytic lesion is being seen. So this is a classic feature of aneurysmal bone cyst, ABC it is called as. I leave all the literature, the clinical features you need to remember, the diagnostic tools, imaging findings, everything you should be ready for the tomorrow's NEETPG. A teenager presents with an incidental finding on X-ray. So, a lobulated radiolucency with a sclerotic border, metaphyseal in location in the distal tibia, and spindle cells, which are the osteoclastic giant cells, is what you are able to see on the histology. They're all typical of non-ossifying fibroma, which is more common in children and adolescents, particularly in the metaphysis of the long bones, is what you need to remember. A patient presents with a long history of the bone pain and deformity. There is a ground glass appearance of the affected bones. So this combination of the radiographic ground glass appearance, pain and deformity, curvilinear trabeculae of the woven bone with a fibrous background is called fibrous dysplasia. One of the favorite questions of the examiner. So where is the mutation in fibrous dysplasia? There are non-inherited genetic mutations in GNAS gene, GNAS, which affect the GS alpha protein, which regulate the intracellular signaling is the histopathology, the chromosomal basis of fibrous dysplasia is what you need to basically remember. Now, doctor, a patient presents with a persistent hip pain, stiffness that improves with rest but worsen with the movement of the movement. X-ray of the hip is being shown. So there is a narrowing of the joint space, subchondral sclerosis, oval radiolucent cysts are being found, peripheral osteophytes leading to the lipping. They're all characteristic of the severe osteoarthritis of the hip joint is what you need to identify. A 40-year-old female, early morning stiffness, several firm masses over the elbows and heels. So these are the classical firm, non-tender nodules with palisade of macrophages. Characteristic of rheumatoid nodules is what you need to understand. Infant presents with a recurrent coughing spells. History of repeated pneumonia. So a barium study, what is it showing? A H type of tracheo-esophageal fistula is what you need to remember. Now, a man presents with a recent weight gain, particularly around the abdomen, which is typical of Cushing's, is what you need to remember. It is Cushing's syndrome, a combination of wide purple abdominal striae, central obesity, along with the hypertension. That is all characteristic of the Cushing's is what you need to remember. Type 2 diabetes, this kind of lesions are there on the shins, which are characteristic of necrobiosis lipoidica, diabeticorium is what you need to remember. Vareva, I'm so happy to see 15 online classmates, doctor. हम बहुत खुश हो गए. So totally 50 full scale NEET PG mock test, doctor. आप कहीं भी कोचिंग लो, ऐप में पढ़ो या फेस टू फेस क्लास जाओ, क्रैश कोर्स को जाके क्रैश करो ब्रेन को, नहीं तो अपने आप लिखे हुए नोट्स को पढ़ो, कुछ भी करो. The Chinese leader Mao said, black or white, catch the mouse and give me. So doctor, we fight on the beaches, we fight in the air, we fight on the land, but we win. So that should be the spirit when you go to the NEET PG. So these 50 full-scale grant tests have 10,000 MCQs. 50 are released as 50 PDF ebooks. Go to learnograph.com, pay $500 and download and give it to 50 of your classmates. No problem. Muft mein dena hai knowledge ko, right? No problem. But sit with your friends, solve the questions, and then finish the revision of the 200 mind maps I give you. Each mind map does important high-yield facts revision. And in the evening, join the discussion with Dr. Murli Bharadwaj. Once you solve these 10,000 mind maps, JJ Singh is asking, sir, are these questions are based on previous year topics? Yes, sir. There are only 1,000 topics from which 200 questions come. Some topics like carcinoma cervix, ovarian carcinoma, endometrial carcinoma, bone tumors, brain tumors, multiple sclerosis, contraception, repeatedly asked. Every paper, हम इस देश के वासी हैं जिस देश में टीबी बहती है. Tuberculosis, at least 2 to 3 questions. HIV, 2 to 3 questions. Like that, you can predict. There is no question paper in the past 20 years without a question on gram-positive, gram-negative cocci and bacilli, streptococcus, staphylococcus, klebsiella. You have to be 100% sure. But you need to get the practice. Reading is different, listening is different, writing notes is different, but reproducing it in a mock test, in a real test, recalling, reproducing, and correctly putting the answer, that is different. So you solve these 10,000 questions, have a discussion, identify where you are going wrong in every topic, revise all the 10,000 mind maps in the 50 full-scale grant tests, you are the king. Right, doctor? So take every opportunity. I'm leaving the link below, learnograph.com. So 500 bucks, you will get a ebook PDF and you get an opportunity to do the revision. You can also share with your friends once you buy the PDF. No problem. So, Dr. Necrobiosis lipoidica diabeticora. A patient presents with a low back pain, morning stiffness, improves with activity, and typically that this is called as between the neck and the wall distance. This is called as, right? It is increased, which is very classical of ankylosing spondylitis is what you need to remember, doctor. Right? Now, elderly patient, progressive pain in legs, elevated alkaline phosphatase levels, and you are able to see curved leg, which is very typical of thickened bone cortices, which is a feature of the Paget's disease of the bone, is what you need to remember. But yeah, everything, anything about the Paget's disease, I leave the literature to you. In one mind map, please do the revision. A patient presents with complaints of double vision during examination. When asked to look at the eye, exhibits nystagmus. You can see this eye is unable to adduct. It's called adductor lag. And the other eye, which already abducted, is going into nystagmus. This is called internuclear ophthalmoplegia, is what you need to remember. So what is internuclear ophthalmoplegia? Everything. I leave the literature for you. It is due to the medial longitudinal fasciculus which connects the oculomotor nerve on one side, which lead to adduction. And the abducens on the other eye. Where is abducens located? In the pons. Oculomotor in the midbrain. Both of them are connected through internuclear ophthalmoplegia. When this is abducting, this will make this eye to adduct. But if this eye is not adducting, means it did not know that the other eye is abducting during the conjugate case. So why? Because the medial longitudinal fasciculus that connects this eye with this eye is having a problem. Demyelination, like multiple sclerosis. That's the reason when this eye is abducting, this eye is not able to adduct. Even though the oculomotor nerve is intact, that's called internuclear ophthalmoplegia, is what you need to remember. So that completes our image-based questions. Doctor, let's run through the clinical vignette-based questions. 60-year-old man, history of construction, chronic cough. Pleural plaques with Prussian blue staining bodies is equal to asbestosis. 43-year-old, shoe tightness, ring tightness means soft tissue growth, which is suggestive of acromegaly. 48-year-old women undergoing hysterectomy. The ureters pass under the uterine artery and near the cardinal ligament, and ureter is at a great damage, is a great danger of getting damaged. So what is the area prosthema? It is the point where you have chemoreceptor trigger zone, where the emetic signals are detected and integrated. It is located in the medulla oblongata and lacks a blood-brain barrier, so that the circulating toxins can cause the stimulation of the vomiting center. 67-year-old man, history of difficulty in walking, balance and coordination, urinary incontinence, sharp shooting pains in the lower limbs, wide-based guide, positive rhombi. So all this is in favor of tabes dorsalis. Whenever there is neurosyphilis, there is a tabes dorsalis. There is an endarteritis obliterans leading to the inflammation of the vasa vasorum of the spinal cord, leading to the clinical features of shooting pains in the lower limbs, urinary incontinence, etc., etc. So I leave the literature about the neurosyphilis. What are the important high yield points that you need to remember in one mind map for you to do the revision. 25-year-old male arrives to the emergency due to the physical fight resulting in facial injury. He exhibits uncontrolled urination, difficulty in balance. Left corner of his mouth appears drooping. So all this is suggest of facial nerve injury. The facial nerve exits the skull through stylomastoid foramen is what you need to remember. 20-year-old exhibits the signs of ulnar nerve injury. Ulnar nerve is the one which supplies the adductor pollicis, responsible and contributes for the pinching movement with the fingers is what you need to remember. 52-year-old with epigastric pain worsening in the night. Recent endoscopy showed duodenal ulcer. So duodenal ulcer bleeding is because of the gastroduodenal artery is the source. Whereas left gastric artery supplies mainly stomach. Right gastroepiploic artery supplies greater curvature of the stomach. Superior mesenteric artery lead to mesenteric ischemia is what you need to remember. A pregnant woman at 30 weeks gestation involved in car accident with hypovolemic shock. And during the emergency surgery to control the bleeding, which structure is at risk? Uterine artery. Uterine artery runs very close with cardinal ligament, is most at risk during surgeries involving the cardinal ligament is what you need to understand. A patient has high-grade fever, chills, typical cerebral malaria features, Plasmodium falciparum. A patient with headache with elevated lymphocytes, normal glucose suggests non-bacterial cause, that is viral meningitis. Now, which virus lead to carcinoma? By inactivation of the tumor suppressor genes. The human papilloma virus inactivate the tumor suppressor P53 and RB, leading to the carcinoma is what you need to remember. Now, a patient has symptoms of influenza, recent history of bird exposure, and the emergence of the new influenza strains is because of the antigenic shift which occurred due to the recombination is what you need to remember. Multiple calcified lesions in the brain in a patient from an endemic area. What does it suggest? Neurocystic patient, the child has paroxysmal coughing, whooping sound, period of flu-like symptoms suggest pertussis, especially in unvaccinated child, is what you need to remember. So a patient who received kidney transplant 3 months ago, elevated creatinine, tenderness over graft site, biopsy showed T-cell infiltration. That's acute rejection. Hyperacute occur immediately in the operation theater only because of the preformed antibodies. Chronic rejection is much later due to fibrosis scarring, not due to T cells. T cell infiltration is the feature of acute graft rejection. So the different rejection types, why do they occur? I'll leave the literature for you, doctor. Now, a 6-month-old, very good to see 14 online classmates. Excellent, doctor. Every teacher enjoys company of more students naturally, right? So you are able to impact more number of lives, more number of people you are able to inspire. That is what every teacher enjoys. So please come to the class every day and एक लाइक मारो और दोस्तों और साथियों के भी बताना कि भाई यहाँ हमको डेली लाइव डिस्कशन मिलता है 50 फुल स्केल मॉक टेस्ट का और ईच मॉक टेस्ट में 40 to 50 इमेज बेस्ड क्वेश्चंस होता, क्लिनिकल विनेट बेस्ड क्वेश्चंस होता. ये 10,000 क्वेश्चंस का अगर हम रिवीजन कर पाए जरूर हमको टॉप रैंक मिल जाएगा. So Marksman is asking, sir, does each mock test cost 500 bucks? Yes, you can download, you can buy and can share with another 10 friends, no problem, right? And if you want all 50 as a package, you can pay only 10,000 rupees. Please feel free to call 9000868 You can WhatsApp in order to uh, get all the 50 full-scale grantees for just 10,000 bucks, right? So, doctor, 6-month-old, severe recurrent infections, failure to thrive, absent thymic shadow. So it is KID, severe combined immunodeficiency. In DiGeorge, it is the thymic hypoplasia, not complete absence of T and B cells. That's what you need to remember. Now, the next question. 50-year-old woman, 1-year history of symmetrical joint pain. Stiffness lasting more than 1 hour. Rheumatoid arthritis, anticyclic citrullinated peptide antibodies are positive, which is seen in rheumatoid arthritis is primarily a T-cell driven autoimmune disorder. CD4 plus T lymphocytes are the ones which are involved. I leave the literature for you. Everything about rheumatoid arthritis and cytokines. You are doing a review session. So which cell capture antigens and present them to the T lymphocytes and initiate an adaptive immune response? Langerhans cells, they are the dendritic cells, is what you need to remember. 4-year-old girl, developmental delay, minimal verbal abilities, bursts of laughter, inappropriately laughter, difficulty with balance and walking, easily excitable, frequent smiling, hand flapping movements, wide mouth, pronounced jaw, deep set eyes, happy demeanor. So, who has that happy puppy appearance, doctor? Typically, Angelman syndrome, frequent laughter, hand flapping, gait abnormalities, balance issues, that is all Angelman, right? So I leave to you the literature. What is Angelman? What is Prader-Willi? Maternal inheritance, deletion of maternal chromosome 15. Paternal inheritance, unaffected in Angelman syndrome. So imprinting disorders, these are all called as. So please review the literature, doctor. 53-year-old, long history of alcohol abuse with abdominal distension and esophageal varices. So typical of cirrhosis. In cirrhosis, you get regenerative nodules with thick collagenous septa is what you need to remember. 45-year-old Southeast Asian, 6-month history of nasal obstruction, frequent middle ear infection, hearing loss, intermittent headache, salted fish daily. Salted fish में क्या रहता है डॉक्टर? Typically preserved foods में high in nitrosamines, which lead to nasopharyngeal carcinoma is what you need to remember. 60-year-old man, severe flank pain, recurrent UTI, large branched stone, it's called struvite stone. Magnesium ammonium phosphate stone is called staghorn calculi or struvite stone. 30-year-old with HIV, with blurred vision, floaters in her visual field. She has CD4 of only 50, high viral load. So typically, a low CD4 count, high viral load, retinitis, CMV infection. CMV lead to large intranuclear inclusion bodies is what you need to basically remember. 39-year-old, family history of diabetes, liver disease, fatigue, joint pain, change in skin color. So diabetes, skin, liver disease, skin pigmentation is all hereditary. Hemochromatosis is what you need to remember. What is that gene, doctor? HFE gene. And why it is called bronze diabetes? Because it's a diabetes due to pancreatic dysfunction, cirrhosis of liver, and the skin pigmentation. And what happens? They develop heart failure, joint pains, hormonal deposits, disorders, etc., etc. Typically, all that brown granular pigmentation, the hepatocytes will be staining positive with the Prussian blue, which will be able to identify the hemosiderin is what you need to remember. Now, doctor, 28-year-old with HIV, cauliflower-like growth in the anogenital area, coilocytes, which is very classical of human papilloma virus infection. A 7-year-old boy with several month history of worsening balance, frequent falls, vomiting, mass in the cerebellum, posterior fossa, typically given that age, is medulloblastoma is the most common pediatric tumor in that particular location of the posterior fossa tumor. 32-year-old working as a construction engineer, occupational exposure to the asbestos is there, typical of mesothelioma. 12-year-old boy, history of cyanosis, loud harsh murmur that is prominent along the left sternal border. Earlier, he has a congenital heart disease. So, ASD, VSD, PDA, these three are cyanotic heart diseases. But they increase the blood flow from the left to right and into the pulmonary artery, leading to pulmonary hypertension. The moment pulmonary hypertension rises, right side pressures will increase and the shunt no more is left to right, but it becomes right to left, which will make it a cyanotic heart disease, which is called Eisenmenger syndrome, is what you need to remember. 21-year-old with schizophrenia, fever and sore throat, antipsychotic medication. So, clozapine among the drugs can lead to a granulocytosis, leading to the development of the sore throat, especially once you start clozapine, or in the case of hyperthyroidism, propylthiouracil. These are the two notorious drugs that lead to a granulocytosis. Propylthiouracil and clozapine need to be basically remembered. 58-year-old, chronic heart failure, elevated creatinine, reduced urine output. Earlier received ibuprofen. So typically, ibuprofen inhibits the prostaglandins, and prostaglandin decrease will decrease the renal blood flow, leading to the renal failure, especially if there is a pre-existing condition like congestive heart failure. So always be careful to give NSAIDs in the patients who are having CHF, is what you need to remember. 65-year-old nocturia, increased urinary frequency, difficulty to start urination. BPH. In BPH, what is the drug we give, doctor? 5-alpha reductase inhibitor, which is called finasteride, is what you need to remember. A farmer is brought to emergency with muscle weakness, excessive salivation, OP poisoning, which lead to cholinomimetic excess, which need to be countered by giving the atropine. So I leave literature to you about OP poisoning in one single mind map. A 50-year-old with Hodgkin's lymphoma who is on ABVD regime. So, which drug in the ABVD regime lead to cardiomyopathy, doctor? Doxorubicin is known to lead to cardiotoxic effect, leading to dilated cardiomyopathy, heart failure, etc. on the 2D echo. So that's a point you need to remember. Now, doctor, a 70-year-old with history of hypertension, chronic atrial fibrillation, no history of stroke. So for long-term anticoagulation in atrial fibrillation to reduce the risk of thromboembolism, what do you give, doctor? Warfarin is the one which is basically indicated. A patient with CKD has a volume of distribution of 2 liters and half-life of 40 hours. What is the clearance of medication? So clearance is 0.7 into volume of distribution divided by half-life. So 0.7 into 2 liters divided by 40 hours will give you 0.035 liters per hour. So one MCQ definitely comes on the volume of distribution, half-life, first order kinetics, zero order kinetics, everything you should know, doctor. So by the time you finish 50 full-scale mock tests, you finish 10,000 MCQs, and each mind map will give you 4 or 5 points. So 50 to 60,000 high yield fact revision ekdam mein ho jayega. So wherever you are taking coaching, don't forget what you need to be winner is this 50 full-scale mock test for the NEET PG by Dr. Murali Bhardwaj. 48-year-old with numbness in his feet, difficulty walking, burning sensation of his legs. So typically alcoholics, daily chronic alcoholics develop alcoholic neuropathy in the stock and glove distribution, peripheral neuropathy, because the thiamine deficiency is what you should remember. 32-year-old intermittent double vision and difficulty swallowing is equal to myasthenia gravis is what you need to remember. Episodic diplopia and bulbar symptoms that fluctuate is myasthenia gravis. 70-year-old man with the history of atrial fibrillation on anticoagulation therapy, sudden onset of left-sided weakness and slurred speech. There was an ischemic stroke, no hemorrhage. Thrombolytic therapy started, but he became drowsy 2 days later and weakness worsened. So always a ischemic stroke, whenever you start thrombolysis, it can convert into a hemorrhagic stroke is what you need to be careful about. 46-year-old, recent history of heroin, blurred vision, difficulty swallowing, progressive weakness, bilateral ptosis, symmetrical limb weakness, clear sensorium, that is important. Clear sensorium distinguishes this from opioid intoxication or withdrawal. So, recent heroin injection raises suspicion of a wound contamination with the descending motor paralysis means possibility of botulism. So, administering botulism antitoxin and start ventilatory support is very important to manage this case. 39-year-old involuntary jerking movements of the arms and the face, irritability, trouble organizing his daily activities. His father had similar symptoms when he was 40-year-old. So chorea, psychiatric symptoms, familial pattern, phenomenon of anticipation where father gets at 60, son gets at 40 and his son gets at 30 only. That is called phenomenon of anticipation, because Huntington's like this, Huntington's chorea like conditions are all because of the trinucleotide repeat. As the generations pass, that erroneous trinucleotide repeat will worsen and that lead to the development of all this worsening phenomenon of anticipation. 35-year-old with von Hippel-Lindau's disease. MRI show multiple cystic nodules in the cerebellum, bilateral renal cysts. What do you need to do? You need to do ophthalmological assessment to know the retinal involvement. So what is von Hippel-Lindau, doctor? Mutation in the VHL gene on the chromosome 3. Autosomal dominant. Cerebellar hemangioblastoma, retinal hemangioblastoma, pheochromocytoma, renal cell carcinoma with a clear cell subtype. These are all the features of the VHL. That's the reason you need to do a ophthalmological assessment for retinal hemangiomas. 12-year-old, recurrent bilateral headaches every month during school exams. Similar headaches during her adolescence. No neurological deficits. So recurrent episodic headaches are associated with migraine. So acetaminophen or NSI is the one which you need to give. 55-year-old with a history of psoriasis with facial puffiness, enlarged firm kidneys on palpation and proteinuria. Any chronic inflammatory disease like psoriasis can lead to secondary amyloidosis. You need to do tissue biopsy for amyloidosis confirmation is what you need to remember. 48-year-old recently started on amitriptyline for chronic pain, develops blurring of vision. Remember, amitriptyline has anticholinergic side effects, which can lead to sphincter pupillae paralysis, leading to blurring of vision. So orthostatic hypotension, blood pressure changes, urinary obstruction, because the bladder paralysis, they're all the anticholinergic side effects caused by the amitriptyline, often given as a antidepressant you need to be watchful about. 52-year-old with a history of breast cancer, Treatment include lymph node dissection, persistent swelling, heaviness in the left arm. So whenever there is any chronic lymphedema, especially after the breast cancer treatment, because of the axillary lymph node dissection, you have to apply compression bandage and initiate physiotherapy. 56-year-old, history of hypertension, chronic kidney disease, sudden onset of the big toe pain and swelling after a weekend seafood binge. He is obese. So whenever big toe pain, cruciating pain is equal to gout. In acute gout, there is no role for allopurinol. Remember, acute gout, no allopurinol. Acute gout, no allopurinol. What do you need to give? You need to give NSAID. So begin indomethacin for acute gout attack. Relief is what you need to remember. 68-year-old, history of coronary artery disease, comes to the emergency room. Shortness of breath, elevated JVP, pitting or edema in both legs. He is currently taking aspirin, atorvastatin, metoprolol. So, whenever the patient has symptoms of decompensated congestive heart failure, what is the king among the chemicals to treat? It is the ACE inhibitors. ACE inhibitors. You can use thiazide diuretics, you can use nitrates, they may be helpful, but ACE inhibitors have a strong evidence of improving the outcome whenever the patient is having heart failure, is what you should remember. 45-year-old, saddle area numbness, severe low back pain, difficulty urinating, intermittent back pain. So decreased sensation, perianal area, diminished ankle reflexes, everything point towards coda equina syndrome, especially urinary retention, saddle anesthesia. They are the hallmarks. Diminished ankle reflexes. Typically, they suggest S1, S2 nerve involvement. Urgent MRI of the lumbar spine need to be done. 60-year-old with a history of type 2 diabetes, with a kidney disease, with episodes of confusion, palpitations, diaphoresis. So, whenever patient has CKD, chronic kidney disease, insulin is cleared by the kidneys. The moment kidney is damaged, insulin clearance decreases. Insulin little only will remain high. And that's the reason they go into hypoglycemic attacks. That's the reason CKD patients, you need to be doubly careful. Insulin, you need to decrease the dose because of the decreased renal clearance is what you need to basically remember. 63-year-old with a jaundice, with a clay-colored stools, loss of appetite, history of chronic smoking, enlarged gallbladder. Jaundice with a palpable gallbladder suggests the obstruction is a common bile duct, typically due to pancreatic head tumor. Non-tender gallbladder enlargement is also called Carvoiser's sign. What did Carvoiser say? If it is a palpable gallbladder, it is a tumor. If it is non-palpable gallbladder, shrunken gallbladder, that is due to cholecystitis, chronic cholecystitis is what you need to remember. Cholangitis, choledocholithiasis. In all of them, there is gallbladder shrinkage, not an enlargement. Enlargement is there in a jaundiced patient with a palpable gallbladder, means there is an obstruction in the common bile duct, typically because of the pancreatic head tumor. A 4-day-old infant newborn presents with jaundice. So typically in breastfeeding, first week, there is a development of jaundice, increased frequency of the jaundice. It's called breastfeeding jaundice. Why does it happen, doctor? It is due to increased enterohepatic circulation of the bilirubin. Frequent feeding can help to reduce the bilirubin levels. Breastfeeding jaundice presents with jaundice in full-term newborn. It is due to dehydration, increased bilirubin due to less frequent stools. Increased frequency of the breastfeeding will enhance hydration and bilirubin's excretion and phototherapy may be required for high bilirubin levels is what you need to remember. A newborn exhibits growth retardation, prominent occiput, clenched hands, overlapping index fingers, low set malformed ears, small jaw. They're all the features of Edwards syndrome, which is trisomy 18, is what you need to remember. A 6-year-old brought to clinic by the foster parents due to the aggressive behavior towards peers, persistent nightmares. So typically in that foster home, typically he has a domestic violence. The post-traumatic stress disorder is causing all these symptoms to happen. A 6-year-old girl, persistent leg pain, especially at night, recent refusal to walk, multiple bruises. They all suggest a bone marrow involvement, pallor, bruising, fever, hepatomegaly, and splenomegaly. They all align with the symptoms of acute lymphoblastic leukemia. One MCQ on the leukemia, ALL, AML, CML, CLL, hairy cell leukemia, which is HCL, and myelodysplastic syndromes, polycythemia rubra vera. All these topics, you must crush them down. 2-year-old boy brought to emergency, choking of a small object. He has a habit of putting things in the mouth. Child is drooling and has a weak cough that suggests swallowed a small toy. 4-month-old, previously healthy, 2-week history of worsening cough, whooping cough, post-stressive vomiting suggests pertussis infection. So azithromycin is considered to be the appropriate initial treatment. 6-month-old infant, heart murmur, failure to thrive, loud holosystolic murmur, left sternal border. Typically moderate sized VSD. What is the complication? ASD, VSD, PD at a point of time will lead to increased blood flow from left to right, leading to pulmonary arterial hypertension is the complication. Full-term newborn, poor feeding and jitteriness 12 hours after the birth. Mother has history of gestational diabetes. So typically, whenever the maternal diabetes is there, there is a risk for neonatal hypoglycemia because the maternal hyperglycemia induced fetal hyperinsulinemia. So poor feeding and jitteriness is common signs of the hypoglycemia in the newborns is what you need to remember. 38-year-old woman, pruritic rash, progressive worsening in the past few weeks. Rash initially appeared as small pink patches, then progressed to become larger, scaly plots. Christmas tree pattern. What else is needed? Pityriasis rosea, colorette scaling, Pityriasis rosea, Herold patch. Initially a patch followed by generalized body rash is once more characteristic feature of Pityriasis rosea is what you need to remember. 50-year-old patient, well demarcated, raised red to purple clots of the cheek, enlarged over several months. So there is a clear area of the uninvolved skin between the epidermal layer and the lesion, which is typically called Grange zone. Clear Grange zone is a feature of granuloma faciae. So Grange zone क्या होता है? Absence of Grange zone, presence of Grange zone को कैसे इंटरप्रेट करना आपको पता चलेगा अगर आप learnograph.com को जाके PDF को डाउनलोड करें तो. 24-year-old presents in April with a large round salmon colored patch in the back that appeared a week ago. Multiple smaller patches spreading across the trunk, otherwise healthy. So typical of Pityriasis rosea. Herold patch followed by smaller patches are indicative of Pityriasis rosea. 30-year-old woman, history of atopy, 2-week history of itchy blisters on her hands and feet after wearing the jewelry. So the description of these vesicles resemble tiny perils, such as form follicles. So the Association of Jewelry and Adobe supports a nickel sensitivity component. And what is the treatment of the pharmacology doctor? First line treatment is topical corticosteroids is what you should remember. 7-year-old girl with a sore throat, fever, red rash, the spread on her face and has spread on her trunk. So sore throat, fever, sandpaper-like rash, and strawberry tongue is indicative of scarlet fever, which is caused by group A streptococcus is what you need to remember. 45-year-old, numb patches of skin, thickened nerve palpable near his elbow. Finish. Leprosy is the diagnosis. 6-year-old brought to pediatrician. Typically irregular shaped, smooth-edged, light brown patches. What are they? Capsulate spots with smooth borders. It's called Coast of California appearance. Are characteristic of neurofibromatosis type 1 is what you need to remember. Similarly, axillary freckling, also called as Krauss sign, is another criteria for neurofibromatosis type 1. I leave the literature for you. Right? So what are the various hyperpigmentation syndromes? Lamb syndrome, leopard syndrome, name syndrome, Poems syndrome, Carney complex. Carney complex is another name for lamb and name syndromes. Lamb is what? Lentiginous atrial myxomas, mucocutaneous myxomas, blue nevi. Leopard, lentiginous ECG abnormality, ocular hypertelorism, and pulmonary stenosis. Name, nevus, atrial myxoma, myxoid neurofibroma, and epithelites, which are the freckles, is called names. What is Poems syndrome? Polyneuropathy, organomegaly, endocrinopathy is M protein with skin changes. Is Poems syndrome is what you should remember. Doctor. Now, the next question. Yes, 17-year-old girl, persistent itchy rash on the neck and the upper chest, affected skin appears scaly, coral red under Woods lamp exam. That's a very important clue, which is a feature of erythrasma, which is caused by Corynebacterium minucitum, is what you need to remember. 3-year-old with the blisters on the knees and elbows after minor falls. They do not seem to heal properly, leave behind a scar tissue. The child's parents are first cousins and there is a family history. So, dystrophic epidermolysis bullosa with recurrent blistering and scarring in trauma-prone areas suggests epidermolysis bullosa. A newborn with a history of difficult delivery develops firm erythematous nodules on the back and shoulders on the second day of life. He was born prematurely. It's a classical subcutaneous fat necrosis in newborn. So it's also any fat necrosis and inflammation means paniculitis. Paniculitis means septal paniculitis, lobular paniculitis, scleroma neonatorum, subcutaneous fat necrosis of the newborn, pancreatic fat necrosis, alpha-1 antitrypsin deficiency, and infectious paniculitis. That's how you divide it, paniculitis. But what is paniculitis? Paniculitis is the infiltration of the subcutaneous tissue by inflammatory or neoplastic cells, leading to induration and swelling of the skin is what you need to remember. 26-year-old brought, they exhibit delusions, auditory hallucinations indicative of psychosis. The acute onset, lack of insight, such as psychotic disorder. So, schizophrenia is the diagnosis. So, psychosis versus neurosis. Insight is preserved in neurosis, insight is absent in psychosis. Judgment and reality testing is impaired in psychosis, preserved in neurosis. Delusions and hallucinations are present in psychosis, absent in neurosis. Personality and behavior is preserved in neurosis, whereas absent in psychosis. And mania, schizophrenia, they're all psychosis. OCD, post-traumatic stress disorder, panic disorder, generalized anxiety disorder, they're all the examples of the neurosis is what you need to remember. Now, a 32-year-old, history of depression, catastrophic event. He complains that he is responsible for this world suffering. He should be punished for his sins. Express feelings of extreme guilt. That is a characteristic feature of the major depressive disorder with psychotic feature. I leave the literature to you. Nihilistic delusions, delusion of reference, delusion of grandeur, delusion of guilt, delusion of control, induced delusional disorder. These are all the types of delusions which you need to remember. 45-year-old, persistent sadness, loss of interest in previously enjoyed activities, increase in need for sleep. He is more tired than usual. They're all the classical features of anhedonia. Hypersomnia is the features of major depressive disorders is what you need to remember. 26-year-old, sudden onset of the blindness, inability to move her right arm. She becomes indifferent to her symptoms. But physical examination does not support the neurological assessment is not supporting. Classical of conversion disorder, symptoms of paralysis, blindness with no medical explanation, defines conversion disorder. Labile indifference is characteristic of conversion disorder is what you need to remember. So, doctor, with this, we call it a day. पूरा 200 MCQs का mind maps are available with a detailed explanation and some more high yield facts on the high yield topic. So today only take every opportunity to download. Go to learnograph.com, download the PDF ebook and enjoy your preparation. Every day, let us become better. Every day, let us consolidate our preparation. Every day, let us pick up some more very common points asked by the examiner. धीरे धीरे रोज रोज बढ़ते हुए 50 मॉक टेस्ट खत्म करते ही आप बन जाओगे टॉपर ऑफ इंडिया, right? So tomorrow once more we'll meet. Already NEETPG mock test 12 ebook PDF is uploaded. Take opportunity to solve the paper. First solve the paper, then go through the explanation. Sit with 2-3 friends and then discuss. Every day your classmate, roommate, benchmate, tablemate, studymate, Dr. Murli Bhardwaj here to give you company, hold your hand and make you the topper. Good night.